If breastfeeding just isn't going the way you imagined, and you're starting to worry about your baby getting enough milk, you might be surprised to learn there's a small tool that can make a big difference: the nipple shield. Hi, I'm Dr. Miki from the Health and Wellness team at UB Health. As the AI face of UB's global network of over 1,200 medical providers and backed by insights from more than 12 million users, I'm here to help you separate fact from fiction. With so much misinformation floating around online, it's more important than ever to get doctor-approved info you can actually trust. Today, let's talk about nipple shields, what they are, when to use them, and how they can help you breastfeed more comfortably and effectively, especially if you're dealing with flat or inverted nipples. So first off, what is a nipple shield? A nipple shield is a thin silicone cover designed to fit over your nipple during breastfeeding. It creates a shape that's easier for a baby to latch onto, which is a huge help if your nipples don't naturally protrude. It also helps draw the nipple out through suction as your baby feeds. I once spoke with a new mom named Alana. Her baby was struggling to latch, and every feeding session left her feeling frustrated and defeated. Turns out, Alana had flat nipples, and she also experienced mild engorgement in the early days. With a little guidance from a lactation consultant and a properly fitted nipple shield, things dramatically improved. Her baby latched, fed efficiently, and started gaining weight consistently. Here's why this works. The shield provides a firmer, more defined surface for your baby to latch onto. It can reduce nipple pain, support milk flow, and even draw out the nipple gently so that over time, your baby may be able to latch without the shield altogether. But before you rush out to buy one, there are a few key things you should know. First, speak with a qualified lactation consultant or your healthcare provider to determine if a nipple shield is right for you. Shield size and design matter. What works for one mom may not work for another. Using the wrong size can cause pain, restrict milk flow, or even decrease your milk supply. So getting guidance really does matter. Second, always make sure your baby's latch is as deep and wide as possible, even with a nipple shield. Watch for signs that your baby is swallowing milk. You can do gentle breast compressions during feeding to help increase milk flow if needed. And keep your baby awake and alert while nursing, or they may not feed thoroughly. It's important to view the nipple shield as a temporary tool, not a permanent fix. Ideally, as your baby grows and breastfeeding becomes more established, you'll gradually wean off the shield. But if it's working well for you and your baby is feeding and gaining weight appropriately, continuing its use can be perfectly fine. The goal is always a comfortable, effective feeding experience. Now let's talk home care. Make sure to clean the shield after every use with warm, soapy water and let it air dry completely. Some moms keep 2 or 3 on hand in case one gets lost or isn't dry in time for the next feeding. One final tip: don't let guilt sneak in. Whether or not you use a nipple shield, what matters most is that you're feeding your baby in a way that works for both of you. Plenty of breastfeeding journeys involve tools, support teams, and a bit of trial and error. That's totally normal. Worried about your own health or just want to be sure you're on the right track? Start by checking in with a UB symptom checker at ubhealth.com. It's medical grade, doctor-approved AI is like having a full on-call healthcare team in your pocket. Always 100% free. And if you found this helpful, be sure to like and follow for more doctor-approved info you can trust from UB Health. I'm Dr. Miki. See you in the next video.